Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with George Escobar, the Chief of Programs and Services at CASA, an immigrant advocacy organization. We speak about the high rates of coronavirus infections in the Latino immigrant community. Let's listen. George, thanks so much for joining me. Could you start by telling our audience a little bit about what CASA does?
Sure. And thank you, Josh, for having me on. So CASA is the largest immigrant services and advocacy organization in the Mid-Atlantic area. So we have offices all the way from North Central Pennsylvania through the heart of our membership, which is in Maryland, and into Northern Virginia. So we provide a wide variety of services from education, workforce development, legal and health services. And we do that in the context of engaging people to become members of our organization. By becoming members of the organization, they're able to act collectively to address a lot of the issues that underlie the reasons why they come to us seeking services in the first place.
That's great. So it's both individual service and advocacy for policy change.
Absolutely. Mm-hmm.
So you are the perfect person for me to ask this question. Why are we seeing such a heavy impact of the coronavirus on Latino immigrant communities?
Sure. And I think maybe it's helpful even to look at what our community does and where do they work, and why does that make them vulnerable to this, right? I think first of all, you've probably seen our community is disproportionately represented in essential workforce that we have right now, right? Even though we're shut down, a lot of there's still folks working out there. They're still cleaning buildings. They're in maintenance. They're doing construction. This is where our community is largely represented. So they're still out there. They're still out there, dependent on their employer to enforce social distancing, all those kind of things. But in many cases are still a lot more vulnerable than you and I are sitting in our homes, right?
Right. So that's factor one.
Yeah.
People are still working in essential jobs, maybe without the protection they need.
Exactly.
What else explains this?
And of course, how do they get to their jobs, right? They're actually using public transportation, right? Another means where they're doing, where they have a lot more interface with a lot more folks, right? So, and where they live. A lot of folks, because of these long-standing issues of affordable housing, right, are forced into shared living arrangements and have multiple families living in one bedroom, two bedrooms, right, in very tight quarters, in large multifamily buildings where this virus could easily spread within those particular buildings, right?
So it's really just an environment that the virus loves to spread in, right there.
Exactly. So we're talking about their work, how they work, how they get to their job, and then when they come home, all of these are factors that leave them a lot more vulnerable to spread.
And that's complicated, of course, by their relationship with the services that they may need in case of coronavirus infection.
Absolutely. And on top of that, you see how they seek support when they need it. How do they receive treatment? Well, in many instances, because of their immigration status, they're unable to seek care. They can't afford it. Because of their immigration status, they're not allowed an opportunity to enroll in health insurance programs, to apply for Medicaid, to apply for any kind of affordable way to seek primary care or go see a doctor.
And they might be worried if they do seek care about immigration enforcement. Is that a serious concern?
Absolutely. And then on top of that, there is the constant fear that they live in, whether they go to work, whether they're taking the bus to work, or whether they're living at home, that they will be visited eventually by immigration enforcement. So even going to the doctor to seek care, especially in an environment where your immigration status determines whether you can get that care, is still going to seep into your head and is still going to be a barrier to actually seek out the care because you think that it's very possible that there could be ICE officials roaming the hallways in a particular hospital or in a clinic, and that presence there might separate you from your family.
Now, does CASA ever hear from healthcare facilities, hospitals about those concerns?
Absolutely. And, as I described before, we do a lot of advocacy and a lot of policy advocacy. And as a matter of fact, we have great partnerships with hospital associations, with primary care providers, all because they're very much concerned about this. They're concerned about the perception, the real and the perceived threats of ICE intervening in their public health duties. So they really request CASA's help in making sure that policymakers, representatives at the local, state, and federal level create protections that guarantee the right of anybody to seek care, and most particularly immigrants and undocumented immigrants that are even more vulnerable.
It's pretty amazing that the hospitals are calling you to help with policy so that they can provide better care because obviously they may be worried that people aren't coming in for care.
I mean, the first time we engaged in this, it really it really struck me, right? Me personally, because to really have doctors and hospital administrators and clinic administrators really be so concerned about this. First of all, makes you realize that this is possible, right? And they may have even witnessed ICE officials combing the hallways, looking for particular individuals while they're sick in bed, laying down, trying to recover, and these doctors are trying to recover the health of these individuals. Right? It's really striking the contrast there in a health facility where you think health is should be completely separated from politics, separated from all of these things. There's only one thing a doctor should be worried about, and that's saving the life of their patient. And yet they're very much concerned about this. So you're seeing all of these factors, the propensity, the vulnerability that our immigrant community has to this virus, just in how they work, how they transport themselves through our community, where they live. And further, you're seeing that exacerbated by the obstacles and the barriers they have in receiving care. And all of those factors work together to show this disproportionate representation of our communities in these COVID positive metrics that we're seeing nowadays.
So, what can be done? What is CASA doing, and what is your policy agenda around that?
I mean, first and foremost, right now it's a question of really providing essential services to those people that are most in danger, right? So I think
Mhm.
the first thing that we're doing is making sure that we're reassuring people about their ability to seek care. We're navigating people to testing centers. We're navigating people to care when they're sick. And those that are sick, we're trying to do our best to focus all our help and our social services to those folks. So, right now we're standing up food distribution centers. CASA was in a place that really did a whole lot of food distributions. Now we're serving more than 2,500 people a week
Wow.
in providing them meals. We've kind of harnessed the power of individual donors. These are individuals that just want to help. These are people that are staying home, receiving their paychecks, and want to provide some sort of financial assistance to those in crisis. So,
Yeah, I heard that once the enhanced food stamp benefits came through, that a lot of the food bank families, for example, were very disproportionately Latino
absolutely.
because they might not have qualified for the enhanced food stamps, and that there's a tremendous amount of hunger. Are you hearing that
Oh
also?
no, absolutely. And that goes without saying that this federal government, the Trump administration, has really targeted our immigrant community. So in any kind of federal package that they came out recently, we heard about the CARES Act, right? That created federal stimulus paychecks, federal stimulus dollars, federal stimulus checks that everybody was going to receive that paid their taxes. Undocumented immigrants, even mixed status families, even if I were a citizen and I married an undocumented individual, nobody in our family would receive a cent of that federal stimulus money. So our entire community has been shut out of these kind of federal programs. Unemployment, they're ineligible for unemployment. So cash assistance was something that we really wanted to focus on because of the need to pay for groceries, the need to pay for medication. So we've been pulling together individual donations into a collective pot that actually provides people some cash benefits. So we provide that in the gift card that we've been providing those people that are COVID positive in our community, people that have been out of work for more than 2 months, people that are suffering another health issue, that are in quarantine. Those are our priority folks that we're providing them these gift cards that we've been able to create from the individual donations we have. And now we're going on over 1,000 folks that we've been able
Wow.
to provide these cash benefits to.
And what about at the policy level? What has been the CASA agenda there?
Right, absolutely. I mean, at the policy level, first and foremost, it's access to care.
Mhm.
Right, it's making sure that that we act on what's called the Medicaid waiver. Right, that we allow folks, regardless of status and their income, eligible to be eligible for Medicaid dollars, and have subsidized care if it's COVID related. Ensure that everybody, regardless of immigration status, has access to testing, number one.
Right.
Ensure that we do appropriate and culturally proficient contact tracing, which is all the vogue now in the public health sphere, right? The contact tracing is just making sure that you register all the contacts that a particular positive person has had, right? So that those people go under quarantine, and then we can package social services to them. But these people are going to be revealing a lot of private information, and they may be again concerned about immigration status. So it's important to partner with organizations such as ourselves, such as many in our area, that have that cultural proficiency to be doing this work, right? And it's ensuring that we learn from the mistakes, learn from the institutional kind of practices that led to this in the first place, led to our community being particularly vulnerable, and build a better public health system in the future, right? Build a public health system that's inclusive. Build a public health system where everybody, regardless of immigration status, is eligible to receive some sort of primary care, right? And that we provide assistance such as rental assistance that right now is a huge issue because our folks in particular, have been out of work for a long time. They're unable to meet essential needs like rent,
Right.
and then we have clear policies at the county, state, and federal level on how we're going to deal with this. Are we going to, are we going to relocate all these people? Are we going to kick them out of their homes? How are we going to deal with the rental situation?
So, yeah, this crisis, which you're seeing in the Latino immigrant community, has just enormous implications for the epidemic overall, because you won't be able to control the epidemic without doing some of the things you're talking about and making sure that communities that have long been ignored really get the attention that they need to be healthy.
Absolutely. And just as your show is doing right now, Josh, I think awareness is the first part. I mean, I think a lot of well meaning people out there do not know this, or it hasn't been foremost in their mind, right? And so awareness and engaging those people that are aware and want to do something at the policy level and making their policymakers accountable is one of the most important steps to making sure that that we learn from this situation.
So let me ask you this, George. If people are interested in learning more, maybe even making a contribution, where can they find more about CASA?
If they would log on to our website, it's wearecasa.org, or just Google in CASA in your Google search function. You'll find our website there. You'll find a link to how to contribute to this cash benefit, cash reward program that we call, that's reliant on individual donors. It's called the Solidarity Fund. Again, because it's a fund in solidarity with our community that's suffering. More than happy to receive a generous donation there. All the money you will contribute to that particular fund goes straight to our community itself. And also on our website, you'll find a lot of educational material on this rental crisis, on health tips for our community. If you have access to the Latino community and would like to distribute some educational material about all this, feel free to use us as a resource as well.
Great. And George, thanks for everything that you and CASA are doing. And look forward to talking to you again soon.
Thank you so much, Josh.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.